Michigan officials are reporting more than 7,000 new coronavirus cases daily. It's rising to levels that rival the state's last major surge around the holidays. The White House says it will send more resources to Michigan for testing and administering vaccines. But the governor's request for extra doses was declined. The director of the CDC is now urging the state to shut down as infections spread.
We know that if vaccines go in arms today, we will not see an effect of those vaccines, depending on the vaccine, for somewhere between 2 to 6 weeks. So when you have an acute situation, extraordinary number of cases like we have in Michigan, the answer is not necessarily to give vaccine. In fact, we know that the vaccine will have a delayed response. Really what we need to do in those situations is shut things down. I think if we tried to vaccinate our way out of what is happening in Michigan, we would be disappointed that it took so long for the vaccine to work to actually have the impact.
And Michigan's Democratic Lieutenant Governor Garlin Gilchrist joins me now from Detroit. Welcome, Lieutenant Governor. Thanks very much for being with us.
Thank you for having me back.
So Director Olinskys says that shutdowns are the way to flatten the curve in Michigan. Why not mandate tighter restrictions now before this gets worse?
Well, first and foremost, we are very appreciative of the partnership that we had with the federal government and the Biden-Harris administration. It's night and day difference between them and the previous administration. And we're also thankful of the offer for additional therapeutics, additional personnel, additional mobile units that can build on the success that the state of Michigan has seen with mobile units being used for testing and for vaccination. We also need to make sure that equity is part of our national response when it comes to this pandemic. And what equity means is sending the resources, including vaccine doses, to the places where the need is greatest. And right now, that continues to be the state of Michigan. And while we have smart health policies in place, the national experts agree, we have restrictions on indoor dining. We have restrictions and limitations on in-person learning. We have limitations on gatherings. We have a requirement that people wear masks. We have policies that, if they are followed, will help us slow the spread. We have to match those policies with increases in vaccine distribution. We've been one of the most efficient and effective states at distributing vaccines, and we can do more. And so we're hoping that the federal government will partner with us to bring more into the state.
But Dr. Olinskys was pretty clear in her message there. She thinks a shutdown is what is necessary, not some of these restrictions that you've just laid out.
We don't think that the federal government should take anything off of the table when it comes to how they can partner with us in Michigan to slow the spread of this virus. We know that as Michigan has gone, so has went the Midwest, and so could go the country. And so we think this is not about taking options off of the table in terms of how we can partner, but instead putting more options and resources on the table. And we think vaccination needs to be part of that equation. And that's why we're making this request and continuing to work with them and have conversations with the administration every day about this important issue.
Is it a possibility that we would see a shutdown here in the near term if things continue on their trajectory?
We're continuing to watch everything that's happening in Michigan. We have a closer perspective on it than most, and that is why we have been asking people in Michigan to really continue to do their best to do their part. The governor's request was very clear. We've seen some organizations and restaurant associations, some of them voluntarily step up to do this. Some school districts, including the Detroit Public Schools, the largest district in the country, agree to continue to go remote. Large school district in our state, continue to go remote. And we're hopeful that others will continue to step up and do their part as well. And we're calling for additional resources from the federal government to strengthen our overall response to this increase in cases.
As you know, the Whitmer administration has publicly battled with the state's Republican state legislature throughout the pandemic, particularly when businesses and restaurants were shuttered during previous surges. Is part of the issue with resistance here based more in science or politics?
Well, I think the Republicans have very clearly politicized this. And this goes all the way back to the previous administration when they took their cues from the former president, who called for them to add politics to a dangerous, violent, and potentially deadly level here in our state. Remember, the January 6th insurrection was round two for people who saw what happened on April 30th, 2020 in the state of Michigan. Michigan Republicans have fought us tooth and nail as we put in place these smart public health policies for the last year, in fact, taking us to court to strip away our authority to be able to fully protect people in the way that we've tried to during this pandemic. And now they're actually even sitting on billions of dollars of coronavirus relief funds, some of which were signed in by President Trump in December. And they still are not releasing those funds so we can have every resource at our disposal to fight this pandemic here in Michigan. So I think the politicization by the Republicans has been very dangerous for life here in Michigan.
Michigan has used about 76% of the vaccine supply that it already has. According to the New York Times, other states like nearby Wisconsin have used nearly 90%. How do you justify asking for more vaccines when some cities like Detroit are struggling to vaccinate residents?
So we've been really aggressive in terms of opening up eligibility in our state for vaccines. We were actually one of, if not the first state in the country to exceed or go before President Biden's call for vaccine eligibility to be open to every person over the age of 16 by May 5th. We did that a month earlier. And we've been working with the administration really every day to make sure that they understand our data and what's happening with our processes. And they have commended the state of Michigan's response. They have worked with us to continue to try to ship more vaccines at previous moments in our pandemic response. And we're asking for them to continue to be responsive to the unique needs of people in states where the virus's presence is the deepest. And right now, that's the state of Michigan. And we've had a program that they have continued to complement. And we think we're going to be able to continue to work with them to add more vaccine doses to that pipeline.
In our final minutes here, Lieutenant Governor, this principle of equity that you mentioned, what would that look like when it comes to a federal response?
So equity means responding in a way that is truly, responsive to where the need is the greatest. There's a difference between equality and equity from that standpoint. And so in Michigan, we have the greatest need because we are seeing the most serious increase when it comes to cases in our state. So naturally, I think our hotspot strategy for the country would need to be responsive and flexible enough to respond to that, because Michigan will not be the only hotspot. We have seen this virus spread and spread rapidly in different parts of the country. And so, if and when this may happen in other parts of the country, we want to make sure that the federal government has a strategy that can respond to those hotspots as well. And I know that this team is capable of it. We've seen them really do amazing, extraordinary things already in this administration. And I'm confident that they can develop a strategy to combat this as well.
So if that's what equity looks like, then what is the message you're taking away from this initial move to decline an increase in vaccines to Michigan?
Well, we continue to have conversation at every level of the administration every single day. And so I'm optimistic that we're going to be able to work something out, because that's what partnership looks like. This is a complete contrast from what we experienced a year ago, when these kinds of conversations were not happening between our administration and the federal administration or the White House. But that's been a different tune here. And so as we continue to have those conversations, we know that they want to deliver for the people of Michigan to keep people safe around the country. And I'm confident that we're going to be able to get there.
Michigan Lieutenant Governor Garlin Gilchrist, thank you very much for your time, sir.
Thank you for having me.